A very good morning to everyone present here. I'm Ishika Chandra, and I will be your host today. Welcome back to the second day of our insightful virtual tour on infertility and MFA. With day one ending with a bang, we're hoping you all continue to enjoy and learn from what we have in store for you today as well. Without further ado, let's get on. Over to you, Casey.
Very good morning to all of you. And today we'll encroach upon something new. Not that, of course, I will be showing you a clipping from the lab, especially as I will be introducing to you one very important component of the lab. That's the heart of the laboratory. That's the incubator. So a 5 minutes introduction to the incubator, which will be followed by a small 2-minute clip into our incubator center, where we will be displaying a number of incubators which are there for EART purposes, which will range from box type, bench tops, tri-gas, mixer, time-lapse, plain incubator, how we do the calibration and all. So it is our incubation research center, which we also have amidst our setup. After that, there will be 2 topics incorporating into 3 small topics, which till now I've kept as a mystery box. So once we come across to it, I will be sharing you, and it will be concerning both the males as well as the females. So none of you should feel that I am let out or I am partisan to one of the sex. Okay. So the introduction to the incubator, followed by a visit to the incubator lab, followed by the 2 talks. In between, you can interrupt me or ask me anything.
To the most important aspect in embryology and the most important gadget, or what I could say the heart of the laboratory, the actual artificial uterus, is your incubator, because this is the main place or the gadget in which your complete process will take place. Right from the time your OCCs are harvested, post pickup incubation, fertilization process, cleavage, uninterrupted incubation, assisted with perfect temperature, perfect CO2 and ambient humidity. So the gametes or your embryos in a well equilibrated media, under all these 3 conditions, all amalgamated together, is the ideal incubation environment. Atraumatic, stress-free, pH friendly. Now, how it is maintained as such? This unit, the display unit, will show you the temperature and the CO2. Plus, there are many other accessories which will tell us the opening of the door, the frequency at which, how long was the door open, the day and the date options. Plus, there are another things like contracon and all, which I will be telling you subsequently. Now, this comes hand in hand with the cylinder console. Now, this cylinder will be of carbon dioxide. It depends upon the weight of gas, whether it's a 15 kg cylinder, 30 kg cylinder, always well regulated by a 2-stage regulator. Why? Because every incubator has a stipulated amount of carbon dioxide under certain psi, that's pound per square inch, which has to be infused inside it. So many a times we see that purging effect, that sound comes then suddenly it stops. Always utilize a CO2 regulator for a CO2 gas. The 2-stage regulators, one will indicate the tank pressure when it is full and one will indicate the flow pressure which is purged into the incubator. Remember, the incubator should not be starved of carbon dioxide, nor it should be overloaded, because otherwise it will mess up the sensitive parameters or the solenoids, other equipments which are inside it. Also important is your delivery line or charging line, because this is like an umbilical cord for the incubator. All the carbon dioxide will be transferred through this. It is said a cylinder should never be placed into the laboratory. It is always in a utility room. But please make it a point that the utility room is not far away. And many places we have seen that they are using those metal pipelines or the gas lines. But many times with the T's and the elbows and the joints, there inadvertently there is a small leakage which creeps in. And when it extends over a certain time frame, unfortunately the shelf life of the cylinder goes down and down, because micro leaks are not detected all that easily. So it is advisable that you can have a utility room just adjacent to your laboratory, maybe a hole drilled in the wall through which your delivery tube can pass, and the distance between the incubator and the cylinder should not be very much. Don't keep layers or meters of charging lines, because there are also many other accessories. There are the clamps, there are the holders, there are the thread sealing tapes. And always remember, you keep a backup CO2 cylinder in case of an ultra emergency. And your in-house embryologist should know how to replace, in an emergency situation, a backup regulator. So there are certain gadgets which need to be in duplicate in an embryology lab. One is a regulator. Second, the bulbs of the microscope, because they are not easily available over the counter. A centrifuge machine, and with your work progressing in bulk, a backup ovum aspiration pump. Incubator is an exothermic gadget. It will work well in an environment which is cool. There has to be a temperature flux difference between the existing environmental temperature and its functioning temperature. So ideally, cooler labs means higher efficiency. Now, why? Initially, or in the olden days, there were what we call it as water jacketed incubators. Now this is a box incubator. Why I'm saying a box? Because it's like a box, compartmentalized inside, huge inner chamber, and in the olden days there was a port over here with a hollow space surrounding all the four sides, and there used to be a water port. So water was poured inside it. It was filling the jacket, so it was water jacketed. Advantage water jacketed: in case of a power failure, the temperature drop down was not all that drastic. Whereas today, water jacketed are not available. They are available but sparse few. They are all air jacketed, because an added advantage in air jacket is what? That you have what we call it as contracon facility or auto sterilization. Means you press this, the temperature shoots up to 110, 120, maintains it there for 20 minutes or so, and then gradually cools down. So it is like the incubator taking care of itself. Now this commodity or this facility could not have been possible in a water jacketed. Now the inner parts. Now as you see, this is a multiple door for the facilitation of keeping our dishes at various shelves. Ideally, the chamber inside is just a single one. These are fenestrated shelves. These are runners. There is a circulating fan. Inside there will be a filter. Then there are two ports for carbon dioxide, two sensors, one for temperature and one for carbon dioxide. Now this alarm which you hear is the piezo effect. Means if you keep the door open for a certain time, the carbon dioxide and the temperature drops down. So when it drops down to a little dangerous level, it will sound an alarm. The pattern of circulation is it comes throughout and it turns over. So the whole dead space or any workable area will be flushed with the carbon dioxide. People ask, first shelf temperature is high or third temperature is high? Temperature everywhere in a box incubator is the same. Minor difference of just 0.1 or 0.15 degrees will be observed upper or lower. Lowermost chamber is a water tray in which, depending upon your product specification, 750 ml to 1 liter to 1.5 liter of pure distilled water is poured in. This is to ensure humidity. So the working ambience is humidified carbon dioxide at 37 degrees. Now, people say that this was a box incubator, so the frequency of us opening and closing will be quite high. Well, it's true, because for every drop, like how we saw right now, and if I was to show you, now suppose I push in the menu, I put in the events logging, events display. Now see here, you can see door closed, door open, door closed, door open, door closed. So you can track. Then subsequently, even this, forget this, okay. Now error table, it's not showing. Yeah, see, what all happens? Sensor breakdown, actual flow, low error, no water, no water. So any problem, it is recorded over here, correct? But then all these things are logged in the door. That's very important. So when you open the door, many have a nasty habit of hanging on the door and looking in. So please don't put inadvertent pressure on the door. All the circuitries are maintained through it. This is the important part as far as QA/QC is concerned. Cleanliness, well, you have your auto sterilization, but still a little bit of manual cleaning is essential. And another question which people always ask, that I am holding my batches 5 times a year or 6 times a year. In the mid time, shall I shut my incubator off? Well, a little bit of yes, a little bit of no. Because if you were to run your incubator continuously, you'll have to keep the air conditioning on. And in places where there are power failures and power surges, it's very difficult to maintain the AC 24/7, 365 days. So what we advise them is, under the worst of worst circumstances, you shut off the CO2, bring the CO2 to 0, close its source, shut it down, completely dry the interiors of the incubator. Absolutely dry. Because what happens? If there is a little bit of moisture left and you shut the door, next time when you open it after a month or even 2 months, you will be faced with that acid smell of the fungal infection. And then it will be very difficult to get rid of that. Some people say, okay, I'll shut off the CO2. I will utilize like a simple incubator, but still the temperature flux can have a toll on the sensors as such. Another thing, what takes a toll is your electrical power surges. We don't mind power failures, but suddenly a power surge where your lights will suddenly glisten high, where the voltage and the wattage exceed its limit. So please, all these sensitive equipments should be there with a backup stabilizer. Usually they are strong, sturdy machines, but please handle them with care. When you clean them from inside, avoid spillage, gently handling of the dishes, library your dishes, who has kept where. It should be a one-man show. And last but not the least, please handle these toggle switches or your press-on switches very carefully, because they are delicate feather touches. As you can just see, I can just press delicately the menu and it comes over here. Maybe options, whatever it is. Okay, hue, humidity, gas tight screen, every parameter has been located over here. Alarm, relay, buzzer, low humidity, whatever it is. So if you want to take a follow-up or a back check also, you can go through it. So this, along with your CO2 incubator, a well set of regulated CO2 dual stage regulator, lovely delivery system, ambient lab temperature, functionality will be at its best. This takes care of the box type. Now, in a challenge to this for prolonged incubation, extending to day 5, We also have what we call it as the bench tops. They are tabletops, each small compartment. Each is a small incubator, accommodating each dish of each person. Of course, the luxury of the space is not there. But the advantage of this is, keep one, fill it, shut it, forget it. So suppose if I want to culture from day 3 to day 5, I will keep it in one chamber, close it, I will open it when I need it. Because now with the concept of single step media is coming in, you have to just load the embryo in a culture dish, a good amount of volume, keep it on day 3, observe it for a check, progression check or a blastocyst check on day 5, and then do the necessary. Options are available large, but still these box ones hold the key. They are the king for the initial phases from the media equilibration till at least I would say the 4 cell or the day 2, they are really preferred. Subsequently from day 4 till day 5 or day 5.5 till the blastocyst condition, well, some people prefer this, or some people prefer to have an added extra second incubator in which gametes for prolonged incubation till the blastocyst are done.
Before we move ahead, I'm sorry to interrupt, sir, but I would just like to welcome Vadya sir amidst us today. Thank you, sir, for joining us on the day 2 of our virtual tour. Sir, you're on mute.
Why are you interrupting, sir? Because he is in a complete flow. And then because of me, you'll find that there will be, the flow will break now. Then the people will get confused with my talk in between and his explanation. Then they will not understand. So anyway, thank you, Casey, for being
Thank
here.
you, sir. Thank you. It's a pleasure having you back. It's
You
a
are doing
pleasure
that
having you back with us.
wonderful, things.
Sure,
So we
sure.
are very happy. And I'm sure the students are getting benefited. Sorry for my interruption.
No, sir. Pleasure. It's a
Because
pleasure having
I
you back.
received the link later. Otherwise, I would have been there earlier. So I will not take any further time. I think you please continue and do that. Students are benefiting a lot. And I
Yes,
don't want to be there in
not an
between.
issue. Not an issue, sir. I would like you to witness a small video which we have of our actual latest achieved incubator research center. It's just a 1-minute video, but it's a pleasure seeing it.
Yeah, I'm there. I'm there.
Sir, we can see the video. You can just play it now.
1 second, 1 second. I'm One second, I'll just try again. Can you see the video? Is it running?
Yes, so we can see the video.
Senior, can you help me out, please?
Sure, sir. Just a second. So you can stop sharing. I'll just share it from here then.
1 second.
Yes, sir. No problem.
Or just let me try once again.
Illusion person and person. Let her lead you told her to create.
Hello,
Yes, sir. I'll just share. Just a second, please.
1 second. Is it playing now? Disaster.
Just a second, sir. 1 minute. I'll share it again. Just 1 minute, please. Sorry for this.
Hello, hello.
You're audible.
So,
Yeah, can I just share it? I'll try sharing it from my side so I can at least break and explain to you each part of the system. Okay, each incubator. I'll just try 1 second. There it is.
The Zoom cover. What are the icons?
Now I can't see the video.
Go to Zoom.
So zoom karya
What is
karas
Zoom?
to.
Go here. Play share video. Play a video.
Can you hear me now? Hello.
Yes, sir.
yes,
You're
sir.
audible.
Yeah, see now this is basically, this is a latest type of an incubator which is known as the cube, CUBE. Now this is like a drawer. You press it, the whole compartmental tray will come out, and each acts as a separate incubator. Each has an accommodation of 7 to 8 dishes. Now, unfortunately, we don't have the actual video which shows you the complete innards of the incubator. Then this is a basically time lapse. Now, with time lapse, what happens? Each dish is kept over here and each dish is photographed simultaneously. So you see on the top, these are the photos of the embryos which are being developed inside. So it's like a continuous video which is being taken. So at any moment of the time, we just have to press the touch switches of well number 1, 2, 3, 4, and you will get the running clips. Now the advantage of these running clips is what? Because what we do is a limited time lapse. We take it out, check it, and we keep it back. But in between, if there are certain stages, some nasty developments which we have missed, this can all be tracked over here without disturbing the actual culturing dish on the incubator. Of course, very costly. It is something to the tune of 70 lakhs to 1 crore 20 lakhs. But the precision which you get is continuous monitoring right from the time the OCC is, or the oocyte is placed, whether it's injected or inseminated, the developmental part, the zygote, all the way to the blastocyst. Because intermittent steps, there may be some micronucleation, multinucleation, excessive fragmentation, or a lapse between 2 dividing cycles. All this is recorded. So this is time lapse, the most latest and the most costliest of the incubator. Now this is also a box type incubator. This is a bench one. So you open this, the flap opens up. There are replacements for 1, 2, 3, 4 dishes. Now in a box incubator, we can accommodate 60 to 70 dishes, but here they are very restricted. Now why restricted? Because suppose I have cultured on day 2 and I straight away want to see the development on day 5. So I will leave it undisturbed. Now a little disadvantage over here is here there are 4 dishes of 4 different people. So when you want to see one, the others are compromised. Now this is taken care of in another incubator, which I'll show you. This is another example of another company. See, 1, 2, 3, 4 plates. Of course, there's inside. This flap is switched up. The flap opens up and you can place the dishes inside. This is the indicator of the temperature of this chamber and this chamber. And at the same time, of course, right now it is off. With the CO2 being on, over here, the level of CO2 will be measured. These are the press button toggle switches. Yes, this is the one. 1, 2, 3, 4, 5, 6. 6 patients in each chamber. Each acts as a separate incubator for a patient. Each has its original display system, 1, 2, 3, 4, 5, 6. So it is each to itself, of course, costly, but the space version and the individuality given for each sample is different. They may be tri-gas. Now, what I mean by tri-gas is usually we use plain carbon dioxide, medical grade carbon dioxide. And I forgot to mention in that incubator series was that in order to regulate the quality of carbon dioxide, there is another filter, what we call it as online CODA filter, which is fitted between the incubator and the cylinder, which will absorb all the impurities of the air, all the solvents, organic impurities. Because if we were to see, or if we were to do a spectrophotometric analysis of the carbon dioxide which is present in the cylinder, you will be amazed to see peaks of so many lethal gases and obnoxious contaminants coming in. Now, howsoever the suppliers tell us that this is medical grade, blah, blah, because they don't realize the importance of culture system. Now, remember, it is this carbon dioxide which will be completely occupying your incubator, which is responsible for modulating the pH of your media, which is equilibrating your media. So this is an environment which is created in the incubator. So what is an incubator? It is your glorified uterus. The embryo suspended in this environment, plus the media, has a scenario quite similar to the uterine environment with the lovely protein-rich uterine secretions and a very lovely capillary bed, proliferated endometrium on which the embryo will come, implant, and process will go on further. So now we come to another type. This is another company, 1, 2, 3, 4. Here is also, see, each chamber, 37, 37, chamber 1, 2, 3, 4, 5, 6. And of course, the carbon dioxide and oxygen content, both are monitored. So trigas means nitrogen, carbon dioxide, and oxygen. Now, why is nitrogen used? Nitrogen is used as a filler in order to control the percentage of oxygen, because the embryos at certain stages of development are very sensitive. If you recollect the diagram of the tube which I had shown you, the initial part had shown in the early cleavage that the oxygen tension is less. As it grows further, develops further, at that time it becomes more. So oxygen, as far as cleaving embryos is concerned, its concentration and tension or pressure has to be regulated properly. These are all magnetic press lock switches. They will just flap open like this. And inside, I think I have a long video of it, but then to see the nitty-gritties of such incubators, your physical presence and observation is very essential. And remember, all of these electrical points are connected to a UPS, uninterrupted power supply, with a sine wave inverter fitted with a stabilizer. So there is no voltage fluctuation, there is no trauma, because in places where sudden power failures take place and they have not fitted themselves with backups, these incubators suddenly start beeping. If the AC suddenly gets shut off, the ambient atmosphere becomes warm, immediately the warning starts, temperature less. Now remember, or let's take a nasty example, that at midnight you are not in the lab, light goes off for 2 hours. The incubators will keep on blinking and sending their alarms, but there is nobody to listen to. Power comes back after 2 hours, they start functioning normally. In the morning you come, you say everything is fine, because here the monitoring system which we saw in the box incubator is not there. So you are not aware as to what happened at night time. You got my point? So nowadays there are alarm systems which are fitted on your mobile phones, just like your in-house CCTV cameras, where you are here, but you can monitor the condition of the room, the security scenario, maybe kilometers away. So what happens? These are known as lab guard systems or sound systems or monitoring systems or lab health systems, which will make you aware of the temperature, of the humidity of the lab, of the nitrogen levels in your cryocan cylinders, of the carbon dioxide levels, or the temperature in your incubators. So this is lab care. It's a gadget, of course costly, but even if you are abroad, scientists in US can monitor from India what the condition of the lab, of the incubator in the lab is. But as I said, it all depends upon powerful connectivity, electronics, and price factor. I'm just missing one thing. Yeah. Now, can you see these two instruments over here? These are actually the CO2 monitors, electronic. There's a feeble cable which is fed in, and electronically it detects how much carbon dioxide is flowing in the chamber of your incubator. Now, this is where, when we calibrate or we regulate the gases which are being perfused in. So when we are setting the incubator or when we are calibrating the incubator, we do so with a known percentage of gas at our end. Now, tomorrow, a person says, I have given you a tri-gas cylinder in which all the 3 gases are mixed. So that is termed as a pre-mixed cylinder. Or certain cylinders have got 3 separate ports, oxygen, carbon dioxide, and nitrogen. From 3 different ports, 3 different gases are pumped in. There is a chamber known as a mixer amidst the incubator, which will mechanically mix the gases and perfuse it into your incubator. So each incubator has its own specifications. So as I told you, the main idea is whenever you buy a product, please read and digest the manual. Now, this is another equipment, what we call it as a closed chamber. Now, sometimes when the lab environment is unhealthy, you are not sure about the air quality, temperature. This is a whole box like an incubator, and your microscope is fitted into it. So when you are working in ultrasterile. It's like a lab within a lab. You have got infusion of carbon dioxide, you have got temperature, you have got a humidity tray, and this is where the tubes in which your flushed aspirates of the oocytes will be come in place. So you can scan, you can handle. These are the hand inserts. These are, of course, your toggle switches over here. So this is providing another alternative in case your lab environment is not as pristine as it should be, or there are some hiccups, you cannot make changes in the walls of your laboratory. So this chamber will ensure you that the working space is clean, hygienic, and atraumatic. You can fix your microscopes, you can even fix your micromanipulator. Now, over here, you can see these two gadgets, and you can see the cryo can. So these are cryo sensors. They will detect the level of liquid nitrogen. So it's a sensor which is dipped in. The moment the liquid nitrogen level goes low, the sensor is exposed to the vapors and there is a crash in temperature. Immediately the sensors will give an alarm, which will be detected by you on your handset. So this shows that the tank pressure or the tank levels are going down. Because remember, all cryo samples have to be immersed in liquid nitrogen, not in the vapors. That's why every canister on the top has a marking which is known as the frost line. Though the vapors also have a fantastic power of cooling, but even at minus 90 or even at minus 120, there is a slight movement of molecules intra and extracellular. But when they are placed in minus 197, that's liquid nitrogen, the whole tissue is a standstill. The only thing which can affect is the atomic radiation. Okay, so even at the tissue will freeze from minus 20, minus 80, minus 120, perfect. But I would say the susceptibility of the sample to those traumatic conditions will still be high unless and until they are not ultra frozen at minus 197. And liquid nitrogen is one of the cryologic liquid which is very friendly. Of course, you have got liquid nitrogen, you have got liquid helium, but nitrogen and helium are explosive, highly inflammable. So what we are preferring is liquid nitrogen, because the only trauma in liquid nitrogen is displacement of oxygen if closed in a closed room. Nitrogen burns if contacted on the skin for a very long time. And the vapors, in case of you just looking it over, it can just damage your eyes. Okay. This is your box, which I had already explained to you. I think this is just a second round. These are also another examples of box incubators of different companies. Now this was, see, in some cases, the display panels are on the head part and the door is just flexible. You can fix from right side, you can fix from the left side. So there is no tension of any electronic damage taking place in the door assembly. Whereas in some incubators, which we saw, one second, I'll show you once again. See, these are the door assemblies on the top, and the one which I had explained you, it had the display in the door. So that was a little more prone to damage. And very important is the table on which you place them should be perfectly maintained at a perfect level. So you have to take the spirit level, because what happens is these doors are magnetic doors. Suppose if the table is a little tilted, so the magnetic contact will be loose. So automatically a display alarm will send you door open. So then you have to manually press it, it will be door closed. So when you place your incubator, the level of the Kadapa platform or your table or your vibration proof table should be perfectly maintained. That's a very important point to be noted. Incubators can't be placed randomly anywhere, because even if the door is slight loose, there will be malfunction. This is an example of a multi-utility incubator in which You can switch off the CO2, you can utilize as a plain incubator, which will be used for HIPPIS-based media, or you put in the gas connector, carbon dioxide can also come into play. It's a CO2 incubator. This equipment monitors the lab health. Air CO2, SPMs, temperature, humidity, all the parameters, because there are multiple sensors in this. So it is fitted in one corner of your laboratory or one wall, and automatically the readings are being continuously recorded. This is a simple tabletop routine, what you call it as clock plus display plus the moisture indication, but the accuracy is quite poor. The least count of the accuracy measurement is not proper. Yeah, any questions? Anybody would like to shoot me right now? Hello?
So we'll be covering the question in the last.
Achane, Magar, you had an idea about the multiple area of incubators available. But of course, the most basic incubator, CO2 incubator, box one, starts from 7 lakh plus GST, plus it is that 70 lakhs or 1 crore if it is a time lapse. Okay. Then of course the tabletops and all are a little more costly, because the more it provides you facilities and more precise. But remember, the electrical part is the lab's concern, the maintenance is the laboratory's concern, upkeep, servicing, calibration, validation have to be done periodically. Our mentality is what, ek baar liya, rakh liya, jindagi par chalna chahiye. No, it's not like that. Occasionally, you have to calibrate it with pre-calibrated incubators to check whether the temperature inside is precise or not. Okay. With measured CO2 portals or measured CO2 canisters to see whether the CO2 which is perfused inside is precise or not. So these are all the duties of the in-house embryologist. So QA/QC for each gadget is sky high. And especially with incubators, you ought to be perfect, because that is the real part. Now let's imagine you are incubating just one case. Pick up kiya apne khali ek hi patient ka. The embryos are showing large amount of fragmentation. They have arrested. Whom will you blame? Will you blame the media? Will you blame the incubator? Will you blame the embryologist? Will you blame the air quality? Will you blame the handling conditions? Or will you blame the poor gametes of the patient? You don't know. It's like a dead end. But suppose you are doing 3 cases together. One case is spoiled. The 2 cases are growing beautifully. So obviously the blame is on the gametes. So the gametes of that person are not proper because they showed a flawed pattern of development. You got my point? So this is your in-house QA/QC, and you should use a little bit of your common sense. But suppose a whole batch of 5 patients goes fat. Well, there are maybe problems. Lab problem at the peak, media problem, temperature problem, in-house calibration, even poor quality injections in that batch which are utilized on those patients. Actually, injections are the culprit most important. And especially in an IVF or EART cycle, the most important injection, which is of prime importance, is the HCG or the trigger. Because the trigger is the one which will help you transform the metaphase 1 into metaphase 2, make the conditions in the Graafian follicle ideal for a pickup, and it will help you mature the quantity as well as the quality. Fine. So now I'll be switching on to the 2 PPTs, which are a little surprise to you till I display the topic. By the way, how many males are there in this batch? Kitne log hai? How many male students? Any idea?
Approximately 10 to 15.
10 to 15. Anyway, chalo, good. Okay, so I share my screen. Am I audible? Am I visible? Hello,
Yes, sir. You're audible and visible.
you can see the screen?
Yes, sir.
Perfect. Now, of course, we are targeting the male patients, or rather, I would say, one second, I just see if you can see the thumbnails also. Yeah. Now, female infertility, female problems, female issues, remedies, these are ज़्यादा हो गए. Now we target towards the male part. Now, apart from production, etc., or spermatogenetic issues, there are also other issues which are equally responsible for the ejaculatory dysfunction. Now, if ejaculatory dysfunction is there, irrespective of the quality and the quantity of the gametes produced, there is going to be a Damocles sword hanging over the head. Okay. So now this is a normal ejaculation pattern in a male. There are different phases: arousal, plateau, lubrication, orgasm, and post ejaculation, there is a resolution. Now it all depends upon your neural impulses: sight, tactile, auditory, except olfactory. Olfactory is present only in other mammals. So these are the phases in which there is a lovely unison of multiple actions taking place, right from the compaction of this or contraction of the muscular part of the epididymis, contraction of the complete part of the vas deferens, because if you take a cross section of the vas deferens or a cross section of the epididymis, they will all be lined with either longitudinal muscles or circular muscles. Because what they do is, when the nerves give them the impulse or the trigger, they suddenly start contracting. Now, these have a lovely store of sperm in the chorda. So when that excitation phase comes, the triggering impulse is there, along with the erection, in which this corpus cavernosum becomes engorged with blood. Now, this is exactly what Viagra does. It increases the blood flow in an otherwise redundant flaccid part, or what we call it as, these are certain erectile tissues. Okay, like the clitoral area of the female, penile area of the male. So a sudden incorporation of blood will make the tissue erect. There will be a blood collection, and in the flaccid phase, the blood regression. Okay, so when this happens, a trigger mechanism sent over here, this contract, the sperm are passed all the way, mix with this contents, and then they are ejaculated out. So what triggers an ejaculation? First, during either act of masturbation or penetration, the friction of the glans penis and the other stimuli sends signals to the nervous system that ends up in an ejaculation. So the walls of the epididymis contract and they carry a peristaltic valve. So what we get is the typical orgasmic phase. And via the vas, forcefully it is pushed in. When this, it's like a pressure. Now this is a big dam and there is a small outlet. You know, the water gushes out with a great pressure. So this is exactly happening. The accessories compress so hard, and the outlet is just a small feeble opening through the penile duct. So obviously that is termed as the squirt of the ejection or ejaculation. You got it? So it has a mixture of prostatic secretion followed by the seminal vesicle secretion. Now, secretion happens, but that doesn't mean it can happen at any time. It has to be a time specific. So according to that, it is broken up into premature, delayed, retrograde, or no ejection. Now, again, it is broken up in details when we study the ejaculatory orders or malfunction of the ejaculatory system. It is a time which we take post penetration. If it is instant, less than a minute or between 1 to 2 minutes, premature ejaculation. Means before the excitation or the orgasmic phase coming to the peak, the ejection is there. Second case, normal, well, between 4 to 10 minutes. Delayed, well, it's dangerous, 20 to 30. So that's the reason when we also tell or counsel the male patients during collection that if even during hand manipulation you are not able to collect a sample in the first 30 minutes, you won't be able to collect a sample. Don't stress yourself out. And last but not the least, an ejaculation. He feels he has gone through an orgasmic phase. That pulsatility action comes, but nothing comes out because it has already regurgitated into the bladder. Now, PE, premature ejaculation, is when you have an orgasm before intercourse or less than a minute. Now, basically, there is no set time. But what happens is once you ejaculate, the erectile potential suddenly crashes down. You got my point? Means what the body thinks a certain act is done, I should be back to normal. So the satisfactory or the enjoyment time is not there. Actually, ejaculatory research, it is done. Measured on a stopwatch, it takes 5 to 7 minutes for a man to reach orgasm and ejaculate. But this ranges. Now, what gets compromised is when the procedure is done and the gentleman is under stress, because it is performance oriented. He will have to think, oh my gosh, within this time I have to justify it. So this takes a long time. It is when one part psychotraumatically takes over the other part. Okay, so this, and if a person knows he is having this, every time when he will just try to control himself also, now, unfortunately, it will be failure. So what is needed over here is perfect counseling, medication, and preventing him from thinking about future failures. It's a common complaint. 1 out of 3 men say that they experience a problem at some time. As long as it happens infrequently, it's not a concern. But when will you take it as a problem? Because when the gentleman complained, sir, before I could even reach a proper excitation phase or the proper penile hardening, I just come across. This is where it happens over repeated intervals of time. Now, some are unable to delay the ejaculation. They have no control over it. I mean, of course, you don't have a control over it, definitely. So ultimately, what happens at the end of it, they feel distressed and frustrated, and they try to avoid it rather than being embarrassed. So this is also one of the reasons. Now, it can be lifelong versus acquired. Lifelong means what? It is starting from the first time till all. And acquired means usually as you have some sort of a problem, you slowly worsen it further. So any problem which is not treated initially will worsen further. So these are the things. This involves a substantial decrease in time to ejaculation compared. So every time if you feel, oh my gosh, now it's also delayed. Oh my gosh, now it's also delayed. Just like a couple who is on a contraceptive for a very long time and they suddenly decide, can any overnight I should get pregnancy. So after every sexual act, they will wait, oh my gosh, I should not bleed this month. I should not bleed this month. And a wash pot of water never boils. So they always bleed. And when they don't want a pregnancy to happen, it always happens. It's a nasty thing. Now, these are the causes. What happens? And these are the symptoms. Okay? Abnormal hormone levels, chemical levels from the brain called neurotransmitters, or inflammation of sexual accessories or the lower UTI organs. It can result into. Okay? And most important is depression. There will be a relationship problem. Every time you try, there will be anxiety. So this will lead into abnormal hormone levels. We always worry about it. That question will always linger about your mind. Curable? Well, medications, counseling, and sexual techniques do help, or a combination, provided your partner equally is helpful to you. But if you feel that you are being joked at or ridiculed at, unfortunately, it will make the matters ultra worse. There are medications available. It will take time to find a treatment or a combination of treatments. Behavioral treatment plus drug therapy. That's what I told you. Now, suppose if you are weak in a subject and you are surrounded by your friends who will always try to boost you up. Nahi yaar, ye to tu kar payega. It will be very easy. Don't worry, yaar. 5 में से 3 marks तो मिलेगा, 2 तो मिलेगा, चल. Then you find out what is the minimum percentage of passing, and then you will say, नहीं, इतना तो मिलना ही चाहिए. So this is what it is. This is motivating behavior. Okay. So this is, of course, effective. But if such a behavior is complicated by another causes, tension at work, stress factor, job factor, this makes the things complicated. So there are treatments. These are the drugs. Zinc-rich foods. Of course, now zinc is very much since that last COVID time also zinc and vitamins. So, but please don't take them in excess. It will lead to hypervitaminosis. Okay. Now there is delayed ejaculation. It's the ulta. Delayed ejaculation can be such a time that at that time the person generally gives up. So it can be also termed as something like an anejaculation. Okay. Again over here, long life versus acquired, generalized versus situational. Now situational means what? A certain new area, or unfortunately, sometimes the guilt, sometimes of having fun and pleasure, multiple partners. So at that time, that guilt factor is always there. So that is a situation. Or maybe again, couple, but the situation is different. Maybe a gentleman has lost his job. He had a nasty day at the office. He keeps on thinking the same thing over and over. So this can also prevent it. Causes, aging, psychological, as I told you, there are congenital, anatomical, neurogenic. Diabetes is mostly responsible. Infections, UTI, endocrine, hypogonadism, and hypothyroidism, and certain medications for other diseases which he is taking. So chronic health issues, anxiety, or a combination of all put together, most important being psychological concerns. Now this is it. Depression, anxiety, or other health issue, relationship problem, poor communication between the couple, always having a prior anxiety. What about my performance? A poor body image, religious taboos, or references between the reality of sex with a partner and the sexual fantasies. Medications, antidepressants, high blood pressure medicines, all are responsible for this parameter. Physical causes, birth defects, nerves controlling the pelvic which control orgasm, surgeries which can be traumatic in the lower pelvic area, diabetic disease and hormone related conditions, low testosterone, hypogonadism. What it can lead to? Diminished sexual pleasure, subsequent outcome which is going to be down the line. How am I going to lead a continuous sex life later on with my partner? And of course, inability to get your partner pregnant. So there are certain exercises which are being given. It is just to strengthen the pelvic muscles. So these are called as Kegels. I'm not going to go into the in-depth of it. Okay. Then anejaculation, which we touched a little bit yesterday. Inability to ejaculate semen despite stimulation due to a psychological or physical cause can be anejaculation. Challenge for the physician because it will take time for him to detect the proper cause. Okay, what is the actual reason? So it's like this. when you climax during sex or masturbation, but you are not able to release the sperm, or what we call it as a dry orgasm. Okay. Now, you are not able to ejaculate even though the penile area rich in nerves is being stimulated. Now, initially, in youngsters, there was also erectile issues. So there was a thing called a stamp test, because usually at night, some youngsters coming into the puberty have got those wet dreams, and they cannot recollect whether the erection or the tumescence had taken place at night or not. So it was a stamp test. It was a very simple old mentality test. On the penile area, the stamps were rolled across and delicately stuck. So obviously, when the erection takes place, the tumescence is there due to engorging of the blood vessels. The phallus swells, so the stamps get ripped off between the two edges, the perforated edges. So in the morning, when the stamps were found to be torn off or broken, it was said, okay, yes, he is having a night tumescence, but unfortunately, during the daytime, he is at a loss to do so. Now, these are the chemicals which cause, and these are the surgeries. So certain chemicals can affect the nerves. And even in the surgeries, if there is a nerve damage, that problem could be helped. Now, in that case, what to do? You have to retrieve the sperm. Now, a sperm retrieval is done manually by an andrologist who will give you a prostatic massage, a finger insertion through the anus, or even when they test the prostatic swelling or prostatomegaly or hyperactivation of the prostate, because prostate is what? It is a gland which is covering the urethra as well as the sperm ducts. It has got a tough leathery tissue bounding it, or a capsule. So when it proliferates excessively, it cannot go out. So it compresses inside. So the duct is compressed. So the gentleman feels continuous sensation of urination, and it is difficult for him to pass urine. So we exert pressure. So the urine pressure has a feedback on the kidneys. Hydronephrosis. Kidneys cannot exude a lot of the urine. Or we can use this electroejaculation, vibrator, sperm aspiration, percutaneous epididymal aspiration, TISA, or testicular aspiration, TISA, or minute testicular apparatus called as TISA, in which the tubules are dissected from the central part of the testis. The whole testis is opened up. And from there, tiny spermiated sperm are being captured from the tubules. When all of this fail, either donor sperm are used. There is no other option. So we come across to this electroejaculation. Accepted mode of sperm procurement in any ejaculatory individual, success rate is good. But what happens is, in all electroejaculates, sperm counts are always high, but motility is always compromised, the reason which is still unknown. And this is the principle. Electric stimulation stimulates the accessories by stimulating the muscles. So the muscles stimulate to contract. So the prostate and the seminal vesicles contract due to the electrical stimulation, and it ejaculates. Now these are the nerves. I've gone a little into the details. I think you can omit this. So any spinal cord injury, this veins, okay, they are the ones which control the functioning of your seminal vesicle, your prostate, the penile area, etc. So a spinal cord injury is a devastating event in a man's life. Many spinal cord injured men are told they are infertile because of their injury, though not often true. But men are often unable to ejaculate properly to their satisfaction, and the sperm production is also compromised if there is a lower back or a spinal injury. So after a spinal cord injury, some can achieve erections, but many are unable to have an erection. So when the erection is not there, obviously expulsion of the sperm will not be there. So what does it result in? Incomplete, impaired fertility, complete infertility, or the symptoms depending upon the extent of the injury to the spinal nerves. Now, this is a famous phenomena, cauda equina syndrome. The bunch of nerves, okay, what we call it as cauda equina is damaged. So the pain radiates lower down. It also affects the anal part. It also affects the bowel part, extrusion, bladder emptying is all compromised. So we do is electroejaculation. This is the probe, is passed through the anus, of course under monitoring, GA, anesthetist, embryologist, patient on the operation table, left lateral position, probe is passed. Here you see, this is the anal opening, this is the large intestine, okay, bladder, prostate, seminal vesicles, both are given a vibratory effect, contracts. When it contracts, the sperm from the duct are being pushed out. Then there is situational aspermia, tension, stress, a suddenly new environment. A gynecologist suddenly telling, you give a sample now, I want to check. I want to know whether you are fertile or not. Now suddenly to a normal man, if the question comes, I hope you are fertile, it strikes you like a bomb. So this is causing you situational aspermia. Suddenly you will be told to use a vibrator. You are stressed out. So these are clinical ejaculations. There is no privacy amongst a lot of patients. Your collection room is pathetic. Demand is huge. You have to give a sample now. Your wife's procedure is at stake. He's under stress. So what to do? Counsel him. Constructive counseling. Assure him, okay, fine. If you're not able to collect today, it's not the end of the world. Collect it. Go it from home. Collect it. Kuch fir karne ki zarurat nahi hai. You have another cycle. Your wife has another cycle. We'll try it next time. In the meantime, try using the vibrator at home. Practice. And last but not the least, logistics of home collection. Bhaiya jamane, hotel jaake aao, collection karke aao. Simple. Approach. It's always uncomfortable about collecting a semen sample for an analysis. They find it embarrassing because what happens? When the staff approaches you or a ward boy or a sister approaches you with a collection container, you say it's so private. We are literally exposed out in the open. We get that feeling. So when the privacy is shunned, obviously your tension starts. But to the staff, it's a routine thing. They are doing it day in and day out, multiple times, 365 days of the year. So for them, it's a medical science. But for us, oh, it's something like a privacy. No, my gosh, I can't allow anybody to know my details. Now, sometimes when a doctor tells to a gentleman in confidence that do you masturbate, sometimes they even hesitate in telling that in front of their wives. So their counseling is separate and multiple together. At the same time, we come to know kaun sach bolta hai, kaun jhoot bolta hai. You know, it's like I say one thing, you say one thing. Now, there is also penile stimulations or the vibratory simulations. Now, this is a room with complete privacy. When this part, lower than the frenulum or the foreskin is drawn, the glands and the corona are exposed. Because this area has a fantastic neural network. So even during a normal intercourse, the friction in the cervix and the vaginal canal is sufficient enough for the nerves to get excited and send a message everywhere to the epididymis, to the prostate. Come on, wake up. It's time for you to act. So the pulsatility comes in, and the more the friction, the more the orgasmic effect, the greater will be the flow. So, vibrator, close your eyes, fantasize sexually, use a lubrication, and don't overdo it. Otherwise, the gadget will become hot. So this is it. The gadget, the pad, the button, the speed. Please do the simple pad, lower part erection, vibration starts, you fantasize, you ejaculate, you collect. Retrograde, produced, unfortunately, bladder dysfunction, instead of this way out, goes back into the bladder. What we are doing is antegrade in a normal man. Just like a uterus, retroverted, anteverted positioning. So this is it. Bladder, prostate, blockage, the valve over here, seminal vesicle, penis, semen pathway, urine pathway. But when this is problematic, semen comes, goes back into the bladder like this. Or comes, zooms in over here. Reasons: bladder cut in surgery, fractured pelvis, neurogenic problem, prostatic surgery, diabetes, or drugs. You have to retrieve them, reduce the acidic shock. Now, you must have known anybody suffering from severe UTI where the urine is burning, because if you see those crystals of oxalate under microscope, they are nasty, very sharp pin-like points. So when you pass the urine, it's an excruciating pain because the inner lining of your urethra is damn sensitive. That's why sometimes you bleed in severe UTI. Why do you bleed? Because those crystals scrape off the lining of the urethra. You got it? So hardly 2 ml of you passing urine and you feel, oh gosh, it's a pain, it's a burn. So you are made to use this cital. What does it cital do? It's sodium bicarbonate. It nullifies the acidic action of the urine. So at least it's like a temporary anesthesia which is given to you. So you have to filter that from you have to filter the sperm from the urine. You have to centrifuge it, check the pellet. But ICSI is only done because the sperm have lost the tendency or the motility. And ultimately from those selected ones, you do the procedure of your ICSI. So in a conclusion, sperm retrieval methods are a boon for the patients who, in spite of having normal spermatogenesis, are not able to fulfill the demands of a parenthood. These are techniques of sperm retrieval. No sperm in the ejaculate or no ejaculate in spite of normal spermatogenesis shouldn't make him a candidate of sperm donation. No, he's producing sperm. So you can't say, "Kare sperm ejaculate mein nahi hai, chala donor le lo." No, that's not possible. You have your level best, you try your level best to do epididymal retrieval, to do the testicular retrieval, to do a massage, to use an electroejaculator, to do a vibrator. You counsel him, and ultimately, that's what I said, proper history taking, physical examination, counseling, and ethical approach, all amalgamated together, are instrumental in providing the hope to the hopeless. Fine? Okay? So I think as far as the male part is concerned, I end this presentation. Okay, so now I go to the next one. Any questions for the time being till I shoot on to the next presentation?
Yes, sir. We have
Yeah.
a few questions before we move on to the next presentation. We'll be presenting the questions on the screen.
Okay, fine. So right now you are amalgamating questions.
Yes.
I think there is a question which has suddenly shot up now.
Yes,
Or
sir.
should I answer it now?
Yes, sir.
See, carbon dioxide is very important because when you are utilizing the media, now media are of two types, HEPAS based and carbon dioxide bicarbonate based. Now, when the media incorporate amino acids, proteins, essential, non-essential, and carbohydrates, they need to be chemically primed. Now, chemical priming is what? It's a long topic in itself, but I will try to shorten it up. You have to bring it in an ideal pH. So in a virgin bottle, they always add a little bit of sodium bicarbonate. So the virgin bottle's pH will be alkaline. Now, in order to make it functionally utilizing, you have to equilibrate in a CO2 incubator at least 18 to 20 hours prior to the use. So you keep it in a tube. Do not fill the tube till the top. Fill it till, say, 4. Suppose it's a 15 ml tube. We will fill it till 8 ml. Close the tube lightly because those embryological round bottom tubes have got the snap caps. Snap cap means you keep it loose, it will allow the infusion of the gas. You snap them tightly, fill for growth. So the empty space of 4 centimeter or 4 ml on the top is known as the shoulder space or the neck space. You keep the tube in a beaker overnight, 18 to 20 hours prior. in a carbon dioxide rich environment in your incubator, the carbon dioxide will perfuse into the neck, saturate over there. It will mix with the water of your media and form a weak carbonic acid, just like a soft drinks. Now the bicarbonate present in the media will equilibrate with the acidic part. So a neutralization reaction will take place, and by 18 to 20 hours, the pH which you had incubated in the incubator, this pH will be quite similar to the intracellular pH of the cell which you are utilizing. Because for a cell in embryology, there are three areas: extracellular, intracellular, and the cell membrane. So any variation in pH, hypo or hyperosmotic, will either shrink the cell or swell the cell. And when this happens, the cytoarchitecture of the cell gets damaged. If they are under equilibrated, also problematic; over equilibrated, also problematic. So to maintain the consistency of the cell, to enhance their viability, a proper equilibration of the media is doing, because the ions which are present should not show fluctuation intra-extracellular, because all will play toll. Because remember, the cells don't have just to survive, they have to prove their step down the line, and the first goddamn cell which is there will be present or will be responsible for the making of an individual, which we are as of till today. So hence carbon dioxide provides a lovely enriched, saturated, humidified environment, which is akin to the environment of the uterus. Fine, next. You mentioned the floor with incubable. See, the floor on which floor pe to nahi, floor ke upar there are tables, there are shelves. Now initially what we used to do was they were keeping the kadappas, but now the system of kadappa is gone. We have got heavy stainless steel tables, and the stainless steel tables and the floor level should be perfect. There should not be even a tilt, because if the tilt is there, the incubator is a little tilted, the magnetic door which is closing will be a little ajar. So obviously the warning will come, door open. And when the door opens, of course, the functionality of the incubator will go down. So on the table leggings, there is also the rotating screw clamp which will adjust the height, just like you see in a washing machine. You see the adjustable clamps, because you have to adjust with a spirit level, which will make it sure if the plane is perfect, the incubator is neither this way nor that way. Because any change in the level, not only the dishes will be tera, magar usna to farak nahi hoga, but the basic important is there should not be any temporary or minutest leakage of temperature or carbon dioxide, which can compromise the incubation or the equilibration. Yep, next. Safety precautions. Safety precautions is, of course, place it in a proper way, away from the flow of the air condition. Don't keep the door open for a long time. Don't keep on hunting the dishes. One man show, proper calibration, cleaning, then what we call it as a setting of temperatures, occasional testing of the CO2 levels. And of course, it's a second child. It needs care more than a child. Next. Delayed ejaculation affect the sperm quality. No. The trouble is, delayed ejaculation, the semen is going to be the same. But when the ejaculation is delayed, because at that time what happens, the penile area will be flaccid. So the complete coagulum won't be coming out. The content of the sperm, the quantitative content of the semen won't be coming out. So obviously, there may be a slight compromise in the visible semen which you collect. Basically, spermatogenesis is going to be the same. The sperm come out in an erection time, it zooms out, quantity, quality, perfect. But sperm are about to come, modus operandi is halted over here only. So the content which comes out will be compromised. So yes, there might be a little defect. Next. Does any ejaculation cause any discomfort? No, any ejaculation will not cause discomfort, because the sexual act is justified. The only thing is that he hasn't ejaculated. Simple as that. Because that's what I said. Infertility in males is in two issues: spermatogenic problem or erectile issue. And anejaculation is failure to exude out semen, either due to a nervous issue or due to a retrograde. Next. I wouldn't be able to answer this because I really don't know the negative effects of this on the serotonin level. Can I go to the next one? Andrologist. See, because andrology is what? Basically, there was just a generalized term called urology. Now, andrology was a part of it. Now, in urology, there are multiple things. All urine-related issue, kidney-related issue, and the male accessory sex glands-related issue. But now with the advancement of infertility so high, a certain branch of andrologists has come out which they totally deal with the problems of the male accessory glands, the erection and the ejaculation, not the spermatogenesis. Spermatogenesis also they can help, but any anatomical issue or penile prosthesis or a surgery or a bladder surgery or a seminal vesicle manipulation or the fossa reopening or priming of the fossa, all this an andrologist will do. Varicocele, hydrocele surgery, torsion repair, etc., etc. All this andrologist does. Sexologist is mostly in counseling. Next. Certain medications. Yes. So every medication, whatever you take, it comes with a contraindication. So of course, now when a disease is there, this ejaculation, we keep it at the back end. We always say, oh, this can affect this, that can affect this. So whichever medication you use, you have to seek what are the contraindications. It's like that. Because certain things act like a certain effect of a drug will be acting on the nerves which are responsible for the erection potential in a male. So they compromise this. Just as I told you, stress. Stress is targeting a basic hypothalamus, and the hypothalamic cells in stress controlling are quite near to the paraventricular and the supraoptic nuclei in the hypothalamus, which control the secretions of the gonadotropin releasing factor. So they mask them. So a person who is in the depression or who is taking psychosomatic drugs, the erection, the sexual fantasies or the sexual pleasure is not there at all. He's not interested into it. That's why we say, because he's not bothered, not he's bothered. His brain is not allowing him to do so. So what happens is one medication proves good for one drug, but that masks the effect onto the other. Okay, good. Next. Thank you. Okay, fine. Yeah, next, now the next PPT. Yes. Can you see it? Perfect. So now we move to the better half, the females, menopause. Okay. Now, contrary, andropause. There are two issues, but there are pauses. Means it's time for you to take a break, whether it takes naturally or hormonally, or it's the law of nature. Now, menopause is defined as a time when the menstrual cycles, permanently cease due to the natural deprivation of the ovarian oocytes from aging. Now, the diagnosis is typically after a woman misses the menses for at least 12 consecutive months. Means now it is the time to put a break. Stock is getting exhausted, depleted. So how it goes gradually. You bleed once in 2 months, then once in 4 months, then slowly, quantity and the quality deteriorates, still it is completely producing a stoppage. Most experienced by the age of 52. But prior to that also, sometimes pelvic or ovarian damage may cause a menopause. There are genetic conditions also which can lead to an onset of an early menopause. Now, similarly in the male, andropause. Andros in Greek means human, pause means to stop. Okay. Now we know sexual dissatisfaction commences from the age of 50 onwards, though it depends upon person to person. Then these are all the other symptoms which simultaneously occur. So we can say, okay, now it's the other side of the slope. You climbed up, peak, puberty, 35 to 40, 45, and now you are going downhill. Now, in a female, menopause, estrogen deprivation, the symptoms. Andropause, testosterone deprivation. Okay? And at the same time, the androgenicity will start dropping down. The estrogenicity will start dropping down. Now, these are the symptoms. Multiple symptoms, huge. In the same case, even in case of men. Multiple effects, fatigue, stress, therapy, chidchida sabhav, irritation, pain, hair loss, bone loss, stress, exhaustion. Even corporate causes will likha hai, but funny. Okay. Then emotional aspects, cardiac palpitations, stages. Perimenopause, first to start, the symptoms are felt at least 8 to 10 years prior. Main menopause, and last is post-menopause. Now, along with it, the deterioration in the level of estrogen means when the estrogenicity is lost, the femininity is lost. Right? Now, how it starts and what are the possible symptoms or what you can see or register yourself, like hot flushes, dry skin, irregular periods. Now, last but not the least, in the last phase, osteopenia, osteoporosis, and heart disease. So this is where HRT, hormone replacement therapy, many of the ladies take. Correct? Now, this is all related to the peak estrogen levels with perimenopause to hai, premenopause. But slowly, slowly, you pass the zone, and ultimately, as the age progresses, your level deprives. Now, this is age-related symptoms. In menopause, 34 symptoms. These are the most regular ones, or most chronic ones, or most predictive ones. Now, this is in case of a female, and this is in case of a male. In both the cases, the sperm will be produced till age 60 or not, but percentage decreases, the fertilizing capacity decreases, because there is no maximum age which can prevent a man from having a baby. But the longer he has, the multiple risks he carries, because even the chromosomal abnormalities take place in a sperm, and the overall chances are reduced. So a man can be very elderly and still be fertile. Now, when we get some symptoms, we think, I'm going crazy. I think I'm losing it now. We always say that. Or we are a gone case. No, you are not a gone case. But remember, these are all premenopausal symptoms. Okay? Natural menopause happens in the early 50s. There is no medical condition. It's a part of a normal body aging. A complete year without menstrual bleeding, in the absence of a surgery or any medical condition which can alter your hormones, can cause bleeding to artificially stop. You are taking birth control pills. Your thyroid is overactive. Even the symptoms can be mimicked. So this is where, in every case, you have to meticulously give a precise and an honest history. Now, what is natural? As we age, productive cycles functioning continues and puberty slows down, it has to stop. Age increases, ovaries, produce a less amount of their endogenous hormone, which is estrogen. With the decrease, menstrual cycle gets compromised, becomes irregular, it stops, and along with that, body changes also take place. Now, this is the dip in the estrogen level down the ages. E2, estradiol, it's a steroid hormone and a major female sex hormone, C18H22O2, dips down as the age goes by. Hormonal levels, adulthood, estrogen, fantastic, postmenopausal, less, progesterone. See, usually what happens is there is a dip. Now, even in the male, how the levels dip? Nothing to worry. Natural occurrence. Some may have it faster, some may have it later, some are quick, some are delayed. Now, when a body makes estrogen, there are basically three types. When in a childbearing age, we always say E2. So this is estradiol, which is a very important marker as far as folliculogenesis is concerned. So the follicles developing shape-wise, monitored with the synchronicity of the increasing estradiol, which is a derivative of estrogen. Then one is estriol during pregnancy and estrone after menopause. Definitely there has to be some female hormone left in the lady. Now, later on, the body will manipulate the changes, the physical appearance and the physiological functioning depending upon the occurrence of the hormones at that time. Now, what does it cause? 5 signs that your anger is because of hormones. We flare up at any time, but chidchide ho jata hai. We go into a depression. Everything we say is always argued upon. We flare up at the drop of a hat. Aggressiveness, irritability, then you say, oh my gosh, I have a headache. So even in youngsters, whenever this phenomena is observed, you always tell, depending upon the period, you get your hormone activated. There can be a hormone deprivation at a certain time. Okay. Women are twice to suffer from depression as men because estrogen and progesterone contribute to higher incidence of potentially debilitating disorder. And depression can also be monitored by loss of cognitive performance. अपन कभी चिड़चिड़ा हो जाता है, भाई क्या करता है आजकल नहीं क्या ये देखना ऐसा क्या होता है, why didn't you use your brain? But it's not, it's the body is not allowing the person to act in that way. Then another thing is osteoporosis. So in that late 40s or at the onset of 50, whenever a lady falls down, she's more prone to fractures. You must have seen, especially hip fracture, the ball and the socket joint, or the hand, or the spine curvature takes place. Because they are susceptible to primary osteoporosis, as osteoporosis is related to the estrogen deficiency. So a drop in estrogen results in osteoporosis. Because the bone formation is also funny. It resorbs and resorbs. A bone will also be there. It's a stock of calcium. Now acting upon your thyroid or especially your parathyroid hormone, the resorption and the reaccumulation of the bone forming takes place. Calcium insufficiency. So this is what exactly it is. If I cut a bone, transverse section, these are Haversian canals. There are 2 types of cells, osteocytes and osteoblasts and osteoclasts. Now, when a child grows, this is called epiphysis. The epiphysis keeps on growing. After a certain age, it seals. But sometimes you have seen certain thyroid or sometimes parathyroid deficient people or malfunctioning, they go to exceptionally tall heights because the epiphyseal closure doesn't take place. So in the olden times, we used to do a phenomena, what we call it as a bone age estimation. So as per the age, what is the size of your bone, the carpals, the metatarpals, the all were x-rayed and the portion or the size of the bone development was taken. Because the whole bone modeling, along with your estrogen as an important part, is regulated by your parathyroids. Now this is the structure. This is a healthy bone. This is an osteoporotic or a brittle bone where calcium deprivation is taking shape. And you see, this is the spine, where the spine bends. This is exactly what is happening. The chances of this bone cracking under pressure or a sudden crumble, because fractures are also multiple types, a crack, a green streak, a Haversian fracture, or a total crumbling part. So this is how the bone formation or the osteogenesis takes place. Ossification of the epiphysis, when complete, then only the cartilage takes place. So many times when there are proper bones, you see there is a cartilage lining still present. Bone replacement में क्या होता है? Sometimes due to the continuous friction, the cartilage wears off. When the cartilage wears off, the bone surface also starts getting wearing off. And when this is to a chronic level, reaches the spongy tissue, the pain becomes unbearable. Now, these are the areas which are very much prone to fracture in an osteoporotic female, which is severely estrogen deprived. Because these are the pressure areas. Now, when you fall, you immediately take a wrist to support. So you are prone to wrist fracture, or poor posture under stress, lordosis, or fall down, the ball in the socket, because this is the most heaviest part, hip fracture. Now, 7 tips to control your menopause: diet, exercise, vitamin D. Today, more than 80% of Indian population is deprived of vitamin D, because of course we don't go out. Sunlight is not proper. And if we try to go out in the morning, breathe the fresh air, we are not breathing the fresh air, we are breathing smog, which is equally dangerous. Okay. So village areas, hillsides, and of course, overexposure is also bad, because once the rays become harsh, the UV content increases, which is more possible to cause skin cancer. Not cancer immediately, it causes the, what we call it as darkening of the skin. Because what happens? Our skin, on seeing the UV light being radiant, it suddenly activates the chromatophores. So they come out. They darken the skin in order to prevent the harsh effect of the UV. So we get a tan. So tanning is the skin's mechanism to fight against the excessive UV. You got it? So why, when we are more in the sun, we tan up fast? Because it's a skin's defensive mechanism. Fair-skinned people suddenly become red. And slowly, the skin tries its mechanism to protect itself. Or if it is chronic, consult the doctor about your medication. Now, this is exactly what I was trying to tell you. Growth hormone, parathyroid hormone, estrogen, all together are responsible for the bone health. Now, women are more prone to osteoporotic bone damages, because bone loss, trabecular bone loss, bone fractures are high. This is what happens in a bone: the formation, osteoblasts form, resorption, the bone में से वह निकलता जाता है, so it is remodeling. Your whole skeleton will be replaced, I think, after every 7 to 8 years, because every part of the body replaces itself. From your liver, unfortunately, lungs is not replaceable. Liver replaces after every 7 to 8 months. Skin replaces itself continuously. Bone replaces. So estrogen deficiency not only accelerates bone loss, but also plays a loss of bone loss in men. Deficiency causes bone resorption. तो जो तुम्हारा bone है ना, वो इसमें से contains calcium के suck होते जाते हैं. So the bone becomes brittle. You got my point? And the replenishment is not there. So they say that when you are osteoporotic, you dump yourself with tons of calcium. It's not right. You should start dumping from the age of 40 to remodel it. Now, second thing, hair loss and menopause. Hair loss during menopause is because of lower production of estrogen and progesterone. They help the hair grow faster for a longer period of time. So deprivation causes them to be thin. Thinning means they are breaking. Iron deficiency can also cause hair loss during menopause. So eat or consume a lot of iron-rich food stuff. Ensure healthy hair. Much like niacin, it contributes to increase blood flow to the scalp and your hair follicles. So the hair follicles are healthy, hair loss will be less. So a general effect. Fetal life ovaries, no estrogen. When they come into adolescence, estrogen production starts. Peripheral effects, you get a lovely hour-shaped figure. When your reproductive age, you start developing follicles. Your menstruation, then you have got fertility. As you come towards perimenopause, reserve dips, estrogens dip, cycles become short. When you are menopause, follicles are exhausted, no estrogen projection. You get amenorrhea, no periods, peripheral effects of estrogen withdrawal. Correct? And last, in the severe phase, all atrophic changes. So this is like a feedback loop. What initially used to happen. In a normal case, what happens down the line? Now, how will you determine your menopausal age? Well, your family history is the best. You will reach menopause the same time your mother reached. It's been said that way. And these are the food materials which are high in phytoestrogen content. It's more like, I would say, bhaji pala ka diet hai zyadatar. Garlic, fruits, apricots, and dry fruits rich diet. So it looks like a very wealthy diet. Then skin patches, estrogen patches, micro release. Patches can help avoid some effects of hormone replacement therapy, and they don't increase the chance of blood clots, because they were saying that excessive HRT can develop into blood complications. And don't expect the effect to take place immediately. It takes a few weeks to a month or 2 to 3 months before we can actually feel that the HRT is working, because let your body get time to newly infused hormone. When you start the treatment, these are the negatives. Tenderness in the breast, nausea, leg cramps. So these are the estradiol delivery systems. A patch, transdermal patch. Content is there. There is a elastic membrane, micro release into the cell, absorption through the skin. So what we do when we are estrogen dependent? We do HRT, hormone replacement therapy or therapy. This is what? It replaces your hormones, which are at a lower level in menopause. So menopause means a change of life. But in order to counteract the peripheral changes, we take, just like when we are dehydrated, saline. When we are dehydrated along with loose motions, Ringer's lactate, because it contains all essential elements. Now this is the female body type. 5 types of are there. Okay. Who needs it? HRT. During the time onset of menopause, when you need, when you are anxiety conscious, depression, fatigue, weight loss, you are an ideal candidate for hormone replacement therapy, but provided it is monitored by a proper gynecologist. Fine. How long should you take? You cannot terminate the treatment in between. Otherwise, whatever you have developed, see, every body takes a time. When an hormone is introduced into it, let the body get adjusted, let the body have a free circulating flow of a proper half-life, let it target certain organs which it is intended to, and then you can feel the change into it. It is not like a quick-acting drug like an Aspro or an Asin. You take it and within 2 minutes your headache is gone. Sorry. Added benefits. Many believe that HRT helps you put on weight, but there is no support. You may gain weight during menopause, but it is not that HRT. So after you get menopause, the advisable thing is eat a diet and keep on exercising. So you lose the unexpected or unwanted weight. HRT increases epidermal hydration, skin elasticity. Now, skin elasticity is usually thing that even today, when we are dehydrated, it's a simple test. You pinch your skin and you release it. The faster it comes back to normalcy in an instant, you are not dehydrated. But slowly the skin keeps on maintaining that shape and then slowly oozes it back, you are dehydrated. That's a simple test, skin elasticity test. Then, what it is, okay, fine. This is important. One observational study in many women found that compared to non-users, HRT is associated with a statistically significant reduction in dry skin, but not atrophy. Atrophy means the skin functioning goes down. Dryness means the lubrication or the moisture of the skin is lost. So HRT appears to boost dermal collagen levels. Now collagen, what collagen is a matrix. HRT therapies are hair friendly. Well, it cannot be said for all. So these are your systems, your tablets, your patches, estrogen patch, estradiol or progestin or non-ethindine patch. Duration, as I said, 3 to 4 months. Contraindications were there that they cause breast cancer. Estrogen only hormone therapy is protective from breast cancer, so it is safe. When used excessively for a very long time, some say it was causing some issues, but once the symptoms pass, once you feel that you are back to normal, or you are feeling yourself again, or your body is no longer deprived of those negatives, you can discontinue the treatment. These are the side effects, and these are the risks which we were taking. Why? Supposed to cause clot, resulting into strokes. Then there were also problems of gallbladder and gallstone. Because what it does is, there were reported cases of increased breast cancer with long-term use, cardiovascular damage, and increase in the C-reactive inflammatory proteins. Well, some have used it for sex change also. Prolonged use. It will generally convert it because certain part gets altered into it. So gender transition is also. Now, last but not the least, very important is contraception. What does it do? Contraception to meet. So this is nothing else but basically a very nice way of birth control measure. A woman cannot be pregnant only if the two gametes don't fuse, or if the man's sperm are prevented from entering, because once the sperm enters into the body, you have got no modus operandi to stop them from fusing. So contraception uses for abortion. Now, when you are when you're using contraception, what is the need to go into a detailed thing like a abortion later? Because abortions cannot be done left, right, and center. Termination of pregnancy till 3 months is allowed, but after that, abortions are not legalized. You have to take a special permission that if a child growing inside your uterus is somewhat abnormal, it has got some genetic defects as calculated from the triple marker, then a court will give you a permission. Okay, yes, this is the right to abortion. I think since last 2-3 months, a lot of new laws have been passed that under certain conditions only abortions post 4 months can be allowed. So this is a famous triangle. So the inverted red triangle is a symbol for family planning in contraceptive devices, just like Red Cross is a symbol for medical services. The goal, birth control. Control the number of children born, especially by preventing or lessening the frequency of contraception. So contraception is basically, we are intentionally preventing it. We know that we are preventing it. Whereas birth control is a generalized terminology. These are the various methods. Caps, diaphragms, pills, condoms, implants, injections, patches, female condoms, IUDs, intrauterine hormonal coil, natural family planning, progesterone, vaginal ring. Or the very nice thing, simply you got to say no. Okay? So no sex or intimate contact unless you are married, or what we call it as just outer course. Everything short of intercourse. Effectiveness is 100% because no sperm is going to enter the vagina. Right? Side effects, you don't have to worry about STDs also. But you have to be gutful in just saying the 2 alphabet words no. If that is achieved, that's a perfect thing. So that is your abstaining from sex. Or this is your outer course, what we call it as. It incorporates in everything except penetration. Right? So all that excitation phase, lubrication phase, whatever, blah, blah, blah will come. But there is no fusion. Best tool. In male contraception, birth control, of course, in male chemical contraception is not that much. In male, the best was vasectomy. Cut the cords, cut the supply line, cut the feeder cables. Bingo. All which will come out is just a plain ejaculate. Right? Though there are barrier contraceptions in which a male condom will be put. But vasectomy is not favored by all. But at the same time, when you use condoms, quality, tensile strength is equally important. Because what happens is the methods which prevent sperm deposition in the vagina or sperm penetration through the cervical canal is a barrier contraception. It causes a barrier. Sperm ko rok deta. Now, different ways. Condom. What it is? Vasectomy. What it is? Coitus interruptus. Well, sounds easy, but extremely difficult. Means post-penetration, you can't withdraw yourself and say, this sperm enter me. No, the first squirt will definitely go in. So it is still there. In real life, 22 out of 100 people, 1 in 5 become pregnant in spite of coitus interruptus. Other methods apart from vasectomy. There can be reversal vasovasectomy, or there was another one method which was found in which a gel was inserted, a synthetic polymer was inserted into the tubes, making it difficult for the sperm to travel from the vasa deferens, or a polymer. Okay, but these are all they were experimental, they haven't mass tried. I don't think of any clinical trial having taken place in such a case. Now, even there is a male pill available. Now, what does it do? They literally block the pituitary production of FSH and LH. So obviously the target organ, the testis, is deprived of the hormonal stimulation. Okay. So progestins. Now prior, there was a compound called gossipol, which was made from sunflower extracts. But then later on, it was found that it was causing hypokalemia, potassium depreciation. So it was banned. WHO had spent millions of dollars on research on gossipol. And it was severely affecting male infertility. Testes were deprived of the sperm. A second, then they thought of a chemical, epomedroxyprogesterone acetate plus a testosterone derivative. Why testosterone derivative was added? So that it at least maintains the functional capacity of the accessory, so a gentleman can ejaculate, but the ejaculate doesn't contain that lethal amount of sperm. What it was containing was just residual spermatozoa. So therefore it started was a male pill. It manipulates the hormonal profile. So the birth control pill, but I think even this is not broadcasted. As a matter of fact, my research, my thesis, PhD is basically on this. Effect of medroxyprogesterone acetate of progestin and an androgen combination. To see the male in, but the thing was, I had done on mammals, that is rats and monkeys and bats. Now, in female contraception, it contains of this. Then there was contraceptive device, what we call it as intrauterine devices, or copper T. It is placed inside. The presence of a copper as an element, I would say, literally kills the sperm. But they should be inserted properly, good quality, and should be replaced after a few years. Then there is also a spring. There was a spring which was inserted slowly into the fallopian tubes. So the presence of any external material and a metal added as a toxicant, the sperm survival is compromised. So these are all of this. Insertion devices, implants, non-hormonal, hormonal, and ultimately sterilization. Hysteroscopy kara do, यूटरस विटरस सब निकाल दीजिए, मेल में वेसेक्टोमी करा दीजिए, फिनिश, रात गई सो बात गई. Now this is how the copper T or Mirena is a very common name. Hormonal intrauterine device provides a long-lasting birth control, a T-shaped plastic frame which releases a type of hormone progesterone. It keeps on releasing from inside. So very carefully it is transferred. It is placed inside very atraumatically into the uterus. Correct? So the hormone which is there, releasing of that hormone, micro release, will not allow pregnancy to take place at all. Surgical procedures, hysterectomy. Uterus, fallopian tubes are removed all. But then when the sexual act takes place, where do the sperm go inside? Well, they will be liberated because ultimately they will be in the body's coelom and they will be expelled out through the normal vaginal secretions. Now, these are the techniques. There is also a very ghastly thing practiced in some foreign countries, what is female genital mutilation. But female genital mutilation was scarring of this vulva and all those areas. But what it used to cause? Severe complications in urinary system, because in a female, the urethra and the vaginal are quite close together. So females are more prone to UTI infections because the two orifices are close, very much close. Or we do is a fallopian tube banding, clamp it, seal it. This can be also done by laparoscopy. Unfortunately, nature of laparoscopy is what? Tubal blockage. Reliability, birth control pills have a high success rate. They can fail and they can get you pregnant even when on the pill. But certain factors have to be minded. If you are, now see, odds of pregnancy without contraception, 85% of women who continue to have sex without birth control, even just once a while, will be pregnant within 1 year. The frequency. A woman will get pregnant if she has sex without birth control on the day she ovulates. So that is why timed intercourse is very important, because a gynecologist will judge the time when you are going to ovulate, the 3 days where the LH peak is high, the mucus secretion is fantastic. Okay, so the chance of the sperm being absorbed by the mucus transferred is very high. Contraceptives that are more than 99% effective. Implant 3 years, 5 years, coils, female sterilization permanent, but still there can be a 0.1% chance of you being on all these things, but still you can get pregnant. So this is not a foolproof way. Then your family planning. Your planning is what? I want children by choice, not by chance. Reliable way, couples to anticipate and attain the desired number of tests, what we call it as spacing. Why spacing is important? Because a female can't be gravid year after year after year after year. It severely compromises her health, her physiology, and also the growth of the child. Now, how it helps? Family planning will increase education, empower women, health, maternal health, prevention of AIDS, environmental and partnership. There is a multifaceted approach to it. Why it is important? Knowing whether you do or you don't want to have a children in the next few years can help mentally prepare you so you can choose an appropriate modus operandi of a contraception. You have fathered or mothered a child. Next question. How long are you going to spend to take the care of your child before having another child back in the line? Or how will your other child or children react when this is called as a sibling jealousy? And in youngsters, the sibling jealousy is quite high. So you have to time your pregnancies. While you age and your partner, your preferences of how to choose your age and when you want children. That's why nowadays there are symptoms, links, double income, no kids. They said, sir, we are very happy in our profession. We don't want kids. Some say 1, enough. Some say 2, complete family, enough. Now their idea of complete families, I don't know whether they have a boy and a girl. But sorry to say, sometimes there is a legacy or a nasty idea in the brain, unless and until I don't have a male child, my family is incomplete. How will my Vansh carry on further? So the craze of the male child sometimes makes you go on and on and on and on till you have a Pied Piper of family on the line. So what are the disadvantages? Family planning by use of contraception prevents pregnancy-related risk, especially for young girls, wherein the births are separated by less than 2 years. Female infant mortality is 45% higher when the children are born between 2 years and 60% higher when births are apart. Back-to-back pregnancies can deplete the nutrients, making the mothers at a higher risk for anemia, complications of uterine rupture, risk of preterm deliveries, low birth weight. About 6 out of every 1,000 women aged 35 and older who conceive a baby 6 months after giving birth suffer life-threatening complications. Now, this risk dropped to about 3 in 1,000 when there was a space of 1 year. Okay. So these are the risks. Of course, I don't want to go into details. Premature birth, early peeling of the placenta or placental abruption. So preterm deliveries, low birth rate, congenital disorders, maternal anemia, autism. The risk is high when pregnancies are spaced less than 12 months apart. Close pregnancies may not give a mother enough time to recover from. Example, pregnancy and breastfeeding can deplete your stores of nutrients. The folic, that's why a lactating mother or a patient, a pregnant mother is always given tons of folic acid. So all your baby's functioning capacity can be compromised. Also risk, you can go through them. Preeclampsia. Now preeclampsia begins 20 weeks of pregnancy in a woman whose blood pressure had been normal. It can lead to severe or fatal complications for both mom and the baby. There may be no symptoms. This can develop instantly. The first sign, swelling on the legs and the water retention, high blood pressure and protein retention in the urine. Best time to reduce the risk of pregnancy complications, research suggests that wait for at least 2 years for a next pregnancy, but less than 5 years. So balance your family. Balancing concerns about infertility, women older than 35 might consider waiting 12 months before becoming pregnant again. Now, when to have a baby is a total personal decision. We cannot infringe upon the family's rights. But you have to make a decision. You want a family, quality. It is not quantity. You want a quality between the two children. Now the stress, high levels of stress that continue for a long time also causes health problems. During pregnancy, stress can increase the chance of having a premature baby, which is born 37 weeks prior, with a very less weight. You know, there are multiple pregnancies, early pregnancies of twins. The children are not more than a palm length. This much. So therefore, they are always kept in oxygen incubators for long. Now, there are multiple chances of problems developing subsequently. Then, what is a fetal distress at that time? Decreased heart rate, fetal moment is non-existent, and then what we call it as meconium. When the baby is still in the uterus, it starts pooping and contaminates the whole of the environment. So these are the signs of fetal distress. So what we do is neonatal stress test, in which majority of the fetus's symptoms are monitored. How they move, their heartbeat, the breathing pattern. Multiple pregnancies, what do they do on a couple? Financial stress. Pregnancy-related anxiety, more in women because of the financial stress. The cost, bankruptcy. And what are the benefits? Helps the woman regain her health, enough time to give her attention to the children, more time to the family. If she is suffering from illness, a good recovery time. So people always say, "Haan, mujhe pata hai, birth spacing is important, limiting birth is important," but what they don't know, a healthy mother or the maternal death can be avoided if pregnancies don't occur fast, and pregnancies occur very fast. So this is family planning. And what are the obstacles? Benefits. It doesn't need chemicals or hormones. Simple abstaining from sex or a contraceptive method, a barrier contraception like a condom, there is no involvement of chemical. So summing it up, it provides the mother, it helps the father, it helps the children. That's the end of it. Fine. Yeah. So this was, I just took it to a new dimension. So it is totally a little different from the usual infertility, blah, 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 which we always do. But excessive spacing of child can also lead into infertility, what we term as secondary infertility. Primary means right from the first conception not occurring, there may be literally an hidden inadvertent cause. But secondary infertility, okay, you have one child, but now it is difficult for you to have a second child. Because after one child, maybe the couple has realized the stress, the trauma, so they were quite scared, so they decided to space it. And then one fine day when you decide, okay, bhai, chalo, mujhe dobara pregnant hona hai, then the obstacles are there. Then they say, oh my gosh, why aren't you possible? So what they do? I am pregnant first time, so I will definitely be a second time. So the time is lost. So the time between the two children is lost so much. And remember, the lady also ages in the meantime. So these are the causes. Fine. Any questions?
Yes, sir. We have a few questions ready.
Yeah.
We'll be presenting the screen.
See, we cannot be exactly sure that at what stage your symptoms are starting. Post 42 onwards, sometimes mild symptoms start. As I said, the initial symptoms start 8 to 10 years prior to the onset of actual menopause. Right? Now, there is no hard and fast line to beyond this is the menopause is starting. Now, sometimes even in young girls, when suddenly the mood deprivation takes place or erratic behavior changes, that doesn't mean that she is having menopause, but definitely there is a reason that there is slight case of hormonal imbalance. So females will start having symptoms of demotivation. Definitely, that's very true. But to what extent do they occur frequently, corresponding to the changes in the cycle? Then is a time for her to detect, oh, am I having the onset of menopause or am I having a premenopausal changes? That's it. Now, this is best monitored by a gynecologist. Actually, this is a topic of gynecologist, but since it relates a little bit into infertility, I've amalgamated all and I wanted to present this to you also. Next. How often should a woman visit her? Well, that depends upon what your initial indications were. That depends upon how your initial symptoms were, how chronic your symptoms were, how uneasy you used to feel, whether you really need an HRT, whether you would insist on an HRT. So your gynec will decide, okay, you do this for some time. After some time, do a battery of tests again, and then you visit. It depends upon the body pathology adjusting itself to the new changes and adjusting and readjusting itself post the medications which you are given. I can't say it will completely, because by the time this osteoporotic stages reach, the bones have already become brittle, right? So what is always advisable is that post 35, that's always said now, after the age of 45 or 40, food has to be taken like medicine, restricted, quality as well as quantity, at the right time, and incorporate the right ingredients. Because when a body fortifies itself, later on when the cascade starts, it has got something to back up on. But if the initial bone itself was weak, and with the onset of this, it has become ultimately at a crash point. No resurrection is going to help you. HRT or estrogen will definitely help you improve many characteristics of facial expression, your skin structure, the loss of hair, and maybe we'll try to reinfuse the bone, but not to the same percentage of what you would have had you started a treatment when you were 40 to 45. Okay, next. In pregnancy possible after menopause with the help of donor eggs? See, today, people ask for embryo donation. Now, embryo donation can be successfully achieved even in early menopausal women. Because in embryo donation, though we actually discontinue this idea, we don't like this idea because by the time she reaches menopause, she's already 45 plus. So when the child will be school going age, she will be 54. So what will be the attention? So nowadays, the ICMR guidelines are also very strict that beyond a certain age, these procedures are not to be done. But let's imagine, I'm not saying a menopausal woman, I'm saying a patient, 37 years, whose ovulation is absolutely in the limbo. So ovaries and the oocytes are redundant. So we can provide is an embryo donation. So in an embryo donation, what it needs, we don't need the functionality of the eggs at all, nor need the functionality of the ovaries. We just have to prime the endometrium. So even in this case, now when we are rightly saying in endometrium priming, progesterone is the most important thing. Progesterone support, what does it contain? It contains progesterone with a little bit of estrogen also. So it is endometrium priming which is essential. Now when you say we have donor eggs, now donor eggs means, of course, you will be fertilizing them in the lab with the husband's sperm, depending upon his age, his seminal parameters, or we can go in for an embryo donation. Now the restrictions on which are also quite severe. So definitely this can be possible. So this is known as post-luteal support or maintenance of your pregnancy or endometrial priming. Which contraception? For the males, best, safest, condom or vasectomy. But since vasectomy involves a little surgical approach, males are hesitant. In females, of course, sometimes even in girls as early as 35, 36, when they have started dysfunctional uterine bleeding, cramping is there. So they undergo for a total hysterectomy, right? That is the safest and the complete way. But if you are having a normal body structure, normal body anatomy, normal body physiology and functioning, and still you want to go on to a contraception, some are against pills because they say pills is an exogenous chemical. Of course, it will mess up your certain system. Your liver enzymes will go sky high, etc., and your body will take time to adjust to it. So in that case, I would suggest we target the male, request him for a barrier contraception with a condom contraception, or of course, what we say now, contraception means, of course, you can have a sexual act and at the same time thinking, I don't want to get pregnant, so that's the only way out. Maybe, or in the family planning, it's the first thing is the two-lettered word no, simple, as my slide has seen. Which contraception? Why chemical methods? Because nobody has bothered much. The males are not ready to take the injections. Females में तो मालूम था ना, sir, I have to go to a function and my period is around the corner. Ma'am, please prevent my period. Okay, pop up a pill. Right? Now, in the males, contraceptive method was research has been going on since years. But what happens was when the contraceptives in a male are given, when the androgenicity is reduced, the peripheral secondary sexual characters dip down so bad that it literally shows out. The typical voice change comes, the figure modulation is funny. And there was a failure of the the accessory glands, the shrinkage of the breast. So there was a loss of libido and potency. So that was actually another deterrent. So when we had done this, we had also given, means I myself had given the injections of testosterone enanthate along with DMPA. So it maintained the libido and the potency of the animals, And when we had dissected them, we found that the prostate and the seminal vesicles were not the normal weight. In fact, they were more because androgen targets them profusely. You got my point. But at the same time, the fertilization rates had dipped. And the similar changes we had seen in the testes, epididymis, the entire reproductive tissues, and also the pituitary. So it was a pituitary hypothalamic axis. Okay. Next. Many surgical. अभी वो कौन सी कंपनी है वो बोलेगा सी already India is booming at the seams. So actually when I was also in this infertility, I always used to say I'm doing an international job. Already we are tearing at the seams and we are thinking, but the trauma which an infertile couple faces is more severe than a person having AIDS. You got my point? Because this is an emotional aspect. Now, insurance companies, they always write in their product, wow, they are at a risk, please read the product. So if you read finally, they write cosmetic treatments are not covered, dental implants are not covered, this is not covered, that is not covered. So what they mean is actual suffering from a disease and you cure it, or a sickness, that is only covered by an insurance company. But you may be, somebody might be given some local support from a company whose boss is very generous or very emotionally involved with you. अच्छा बेटा चल इंश्योरेंस के लिए ले ले तू कॉन्ट्रासेप्शन के ले ले वो बोलेगा तू कॉन्ट्रासेप्शन करेगा इसमें मेरा क्या भला होगा why should I give you money? It's simple like that. Difficult to afford. I don't know why this you had mentioned. Many are not making the see contraception now. Sorry to say, if you tell contraception, what the hell can't you afford? Go and buy a packet of condom. How much it costs? So you can't say it's difficult to afford in a male. You got my point. Now suppose if a female goes for a complete hysteroscopy because she is developing some carcinogenic tissue, then it is justified. Okay, but she said, you know, I'm doing hysterectomy because I want a barrier not a contraception. What the hell? Why should I pay for such a costly affair? Tell your husband to invest into a 20 rupees condom and do the ritual. You know, something like that he will tell you. Anyway, the next one. Next. Now, one child, is the one child policy effective? A little bit of yes, a little bit of no. They say one child means I take it, I rear my child qualitatively, not quantitatively. You got my point. Then they say, no. At the longer run, my sibling will be alone, he will not be having anything to play with. So there are multiple facets to this question. It depends. Basic was छोटा परिवार सुखी परिवार दो हम दो हमारे दो, that was a slogan, right? अभी ये तो हम दो हमारा एक, अभी कभी कभी किसी के हम दो हमारे तीन भी हो सकते हैं, चार भी हो सकते हैं. Then depends, that's an individual choice. Now to make such a choice, it is entirely left on the couple. But sometimes, you know, certain negative fantasies or fancies they take over us now. We just say, no. We just produce. But then the quality of the life albeit suffers, 100%. Now let's imagine two children back to back within a year. So much trauma. People say, नहीं साथ में बड़े हो जाएंगे. वो भी होता है कभी-कभी, no doubts about it. मगर साथ में बड़े होने में उतनी मुसीबत भी आती है. Because what we are ignorant is the complications in a female's body which take place, the problems which take place. And we sometimes don't bother about medical emergencies till they reach the dreadful end. We are not able to read the symptoms. We are not in the concept that by every 8 months I will do a complete periodic body checking of all my profiles or blah blah blah. Now in this COVID times it was there. थोड़े time में अपन RT-PCR कराते थे ना. Every month भागते थे that she का RT-PCR करा के आओ. You know how come? Because we were desperate. So it's like that. Next one. Thank you. Okay.
So we have actually received one more question. Can I read it out for you?
Yeah.
Okay. So the question is, can certain sterilization devices in females be harmful to them? For example, Assure was a spring-like device.
Yes, I think you've seen the movie, I think so. The movie on the TV and on the Netflix. If this ensure the spring device by Johnson and Johnson, I should not name the company, it was inserted, but later on it was very traumatic. It fragmented into pieces. See, the more simpler the device, the more effective it will be. It depends upon the skill of the gynecologist, how to place it. Now this Mirena which is placed is just insert it into the uterus or a copper T. Delicately insert here, atraumatically, finish it off. There definitely a body will definitely be acting against it because it is a foreign invasive agent which has penetrated your privacy. You got my point. So they
Yes.
are it. That's why we always prefer contraception, male contraception by condom contraception, the best. Or एक बार थोड़ा हम लोग tubes cut, finito, end of the story. Or get your tubes clamped. But nobody would want anybody to disturb the already fantastically existing infrastructure in your body. That's the thing. Surgery के नाम से अपन डर जाते हैं. For a dental, we always used to prefer a filling rather than a tooth extraction. Right? It's like that. Right. Anybody else?
No.
No. You're honestly saying no. Okay. So today's topic, I intentionally deviated a little from the infertility part because when you are studying infertility, this is also coming into play. These are what we call it as the subgroups. Okay. That phyla, subphyla, bracket group, blah, blah, blah. When we were doing this goddamn animal classification, you know how it used to go all the way down. So these are also important as far as describing or anticipating the shape of the things to come. Fine. Anything else? Hello.
And nothing else, so we can move.
So what we can go? So I log off.
No, so wait one.
Wait. Okay.
Yeah. Yes. So we're done with everything.
It's up to you.
Okay. No, right from your side.
Yeah, I'm done. See, otherwise we can continue for tons and tons of talks, but
Correct.
it will be too much for you to digest in one day. You know, because a pen drive is something like literally 300 talks all pulled into it. Because you should be in the frame of mind to digest at a certain time. Overuse is also bad for everything. Okay? Okay. So feel free to contact me anytime. I hope you have taken my email ID.
Yes.
Right? Do not hesitate. You can pay me a visit over there also, maybe for your future. बाद में आगे क्या करना है? Though enthusiasm is always more because any doctors who also come to our center for training, I tell them कि यहाँ पर तो सब अपने मुंडी लाते हो. The moment you step out of the building, 10% is out. The moment you step out of the campus, 20% is out. You go back to your hotel, 40 is out. You board the flight, go to your native place, 60% is out. The next day you start your routine work, 100% is out. Then sometimes we call them, sir, lab का क्या हुआ? मैं सर काम करता हूँ, मैं अगले महीने शुरू करूँगा. वो कहते हैं ना होली कभी है, होली अगले महीने अगले महीने अगले महीने. And some are the inverted. Within 1 month they phone, sir, I want to start a lab. अरे भाई, it's not a pack of cards. लेकिन मेरे पास सब कुछ है. अरे सब कुछ है, वो गाड़ी है, घोड़ा है, बंगला है, वैसा हो जाता है. It's not like that. Setting up of a lab is really a challenging thing. So there are over enthusiastic, there are under enthusiastic. But the proper enthusiasm at the proper time, unfortunately, is always missing. You got my point. But it is everybody's now, many are affected in this post-COVID scenario. Many are affected about it because what has happened is some have just jacked up of COVID's reason to jack up the prices. All you know, when you go to a path lab, the person wearing the same protective covering, which from morning till evening, he must be going out to a number of places. So in fact, our home clothes would have been much more sterile than the protective covering. It's irony like that. Now in many labs, when I go, you know, the autoclave drums, when you autoclave a scrub, when you open it and wear it, it should be bone dry. And many times we see even those scrubs are moist and damp. Now, moist and damp scrubs are the biggest contamination. Moisture, it breathes into it. But that ethics, पहनना है ना, means पहन लिया. अभी कैसा पहनना है, how you are autoclaving it, what is the person, what is the pressure of your autoclave, for how much time the pressure is maintained, do you crank up and dry it open, the same like an incubator. So because we know all the things, and why we are handicapped is because the resources are less. And why the resources are less? Because we are not funded. You got my point. The funding is the bottom line. Money makes the mayor go. Like suppose I am going to a lab in India, and of course, very true, we have worked with very professionals also, and they never hesitate about anything. But in a foreign country, the protocol is such that this is a cement container, I take a drop, then I have to discard that pipette immediately. For a next drop, I have to take a new pipette, costing 15 rupees. अभी यहाँ पर अपन क्या करते हैं, वो निकाला, उसको बराबर से वापस उसके जैकेट में रख देंगे, सेकंड ड्रॉप के लिए हम वही इस्तेमाल करेंगे, right? So here, instead of using one in abroad because of the stringent protocols, we use 10. But then who the hell is gonna pay for those 10 pipettes when you are utilizing in our country? You got it? So inadvertently, we are forced to adapt to certain shortcuts. And we don't know that many a times these shortcuts play havoc. If you have time, can I discuss one or two cases with you?
Yes, sir.
Okay. See, what had happened was, there was, in this egg denudation, when you denude an egg, you use a flexipet. You just tease it, the egg gets denuded. Now, for each patient, when you denude the egg in a well, okay, you have to use a new flexipet. So one of another person called me and said, "Hey, मेरा तो last batch पूरा वाट लग गया." मैं बोला क्यों, क्या हुआ? देखिए सभी IVF wells में contamination आ गया. मैं बोला that's very strange. How can it come in all? Then it suddenly clicked me. I just told him, "Did you change the denudation pipette?" लेकिन नहीं सर, चेंज क्यों करने का? मैं तो रिंस करता हूँ ना. ऐसे खाली दूसरे मीडिया में रिंस करने से वायरल लोड और बैक्टीरिया लोड निकल नहीं जाता. Now what that idiot had done was, now it's so you know the hidden point, it's a male embryologist anyway. So he had denuded the wells of a person in which the semen sample which he had inseminated was not properly washed. So it was containing a little bacterial load, maybe the UTI infection or whatever it is. So the first well was contaminated, and he used the same pipette in the second, third, fourth, fifth. So the bacterial contamination went from 1 to 2 to 3 to 4. So just for the sake of spending 800 rupees per case, he messed up the entire batch, running into lakhs of rupees. You see, for him it was, नहीं कैसे होगा, मेरे को तो समझ में नहीं आता, air quality, nothing doing. It was your simple mistake which screwed you up. So we think we are doing the right thing, but inadvertently we don't know how much damage we have done. Now we also feel that the air which we are breathing right now is so pure. Now we must have all be having your farmhouses or wherever, the old tile roofs. If there is a break in the tile, there is a beam of sunlight coming in. You see multiple small particulate matter floating in that beam. These are suspended particulate matter, right? Or on a rainy day when the beam of the headlights, you see the tiny droplets, correct, of water. The same way suspended particulate matter float, and this inorganic suspended particulate matter are lovely vehicles for the bacteria to float around. Right? So that's why air quality is important. Why are you not allowed perfumes in the laboratory? Why is a laboratory cleaning agent absolutely aromatic free? No smell. Because volatile organic contaminants, what they do is in a colder environment, they saturate. You try to peel an orange in a air conditioned lab. You try to just peel an orange and the smell will radiate everywhere. Because what happens? Air, cooler, it condenses. If it was warm, the smell would have dissipated. Like when a room is freshly painted, you get the aroma or you get the smell of that freshly painted room for days together. You immediately ask, "Bhai, chuna chakki karaya hai kya?" What happens is the turpentine which is used as a diluent, its evaporation point is less. So in the heat of the sun also, the paint till it dries out completely, it will keep on evaporating that toluent, and that you can smell it. Or why do you feel that in an IVF laboratory, there is no other procedure apart from pick up and ET done? Because what they do is formaldehyde fumigation. Means the gas of formalin is passed on, and formaldehyde fumigation is absolutely lethal. You cannot enter a room which has been formaldehyde fumigated for at least 1 day. You will start tearing. Lacrimation is used because the formaldehyde papers are fantastically penetrative. It will take 2-3 days for the odor to go off completely, which is absolutely toxic. Now imagine in your laboratory, if that odor entraps itself between the laminar flow filters, HEPA filters, your incubator filters, it is like a cyanide for the embryo. So that's why you have to be very specific. No perfumes, no deodorants, no aftershaves. But people still take it. ये कुछ नहीं ऐसा थोड़ा ही लगाया है. So that's why when you are working in a laminar flow, always the microscope eyepieces are always flush with the table. The golden rule is never put your head in the laminar flow and work, because with the flow of the air, your fluff, your dandruff, your particles in the hair will keep on falling down. So you can do one thing, you can keep a culture dish in a corner of your laboratory one day with the lid open, go away. Next day you come and check the dish. You will be surprised to find so many air particles, contamination threads, fluffs of the hair, multiple cellular things all settled onto it. Now imagine if there was a live spore which was floating in the air and it settled down, it will form a culture plate. Okay, so this is the reason why peripheral HVAC system is also very important. So for an embryologist to have a complete bird's eye view of the laboratory, QA/QC is of prime importance. That's the reason when I showed you the tour of the lab, apart from the multiple incubators, we have got what we call it as analyzers, gas analyzer, heat analyzer, which can detect a temperature fluctuation till 0.1 degree. Now, many labs, they keep their analyzers, but the goddamn analyzers themselves need to be calibrated. You got my point? So when you are messing up a system with your gadget, make sure that the gadget itself is analyzed. Now people say, sir, my medical get carbon dioxide, usme to kya pressure hai? Sometimes when you open the cylinder, hardly the pressure comes and it shoots down because there is a big airlock inside it. When an airlock comes, find the pressure will be perfect, 5% CO2. Suddenly the pressure drops down. Why? अपन करते हैं ना हमारे घर में बोले गैस का सिलेंडर जाते हैं, गैस खाली होने का है, शेक द सिलेंडर ना 2 दिन और चलेगा. We used to do that. Remember why? Because the gas settles down, and when we shake it, it springs up again, or there is an airlock which comes into it. Correct? Because this gas dynamics is also very deadly. Even in a carbon dioxide cylinder, they are given the compressed condition. 500 parts of gas is compressed to 1 part, so it's like a semi-liquid. So when the cylinder is left open, you suddenly put your hand, it's absolutely cold, just like a liquid nitrogen. Liquid nitrogen is also compressed. When I pour liquid nitrogen, I find the vapors because 1 part expands to 700 parts in air. So all these dynamics have to be noted. So it is not that I handle the egg and the sperm and my job is done. It is a peripheral thing. And another thing is very important is documentation. Whatever you do, right or wrong, has to be documented. Because it will really save you the blushes when you have to sometimes answer your superiors, sorry to say, who at many times are equally ignorant. Got it? And they always say, kya ho gaya, itna acha case tha, he was my VIP patient. There was one doctor who was telling me, kaise kuch karne pala, what happened? All my poor patients, bhaji wala, pav wala, baida wala are becoming pregnant, but my VIP patients are not becoming pregnant. I go, sir, that I cannot help it. It is totally beyond my control. So don't keep the nonsensical mentality because only the VIPs need to be positive. And many a times we get carried away. You have time now. Many a times what happens when things are not documented in very sensitive issues, like donation. Now in a city, when you go off in a far-flung village area, the conservancy and the narrow-mindedness is at the peak. So there was a doctor who told me, he is in a soup. Why? What happened? Because there was a very influential, politically powerful couple who had come and they wanted egg donation. Fine. So they brought their own donor, who was her sister-in-law. Fine. Sister-in-law had 2 girls. Very fine. So she was of proven fertility. She merrily gave. The recipient became pregnant. Now the fun started. The recipient who was pregnant got a son. Now the one who had donated had 2 daughters. You got it? So then she said, I want my son back. You got the trauma. So he said, now what to do? मैं बोला तुमने साइन बाइंड लिया होगा, पेपर साइन करवाया होगा, मैंने कुछ नहीं किया. मैं बोला अभी जेल जाओगे तो फाइन करो. There is no other option left. So don't get carried away by these emotions. So everything has to be documented thoroughly. And another, our society till today is crazy about genders. Son. Another incident which had taken place, we had a case, an elderly lady that will coincide with the question which you asked, a menopausal lady can become pregnant or not. A very elderly lady, I think 45, 47 must be her age. She had come with a young girl, and obviously I thought that she has come for consultation of gynec for a girl. So suddenly the girl tells me, sir, it is not, it's my mom. Well, what's the problem? Now that mom had heard from somewhere that embryo donation always results in a male child. And well, that's funny. But I was told by my seniors that because at that time the laws were not that strict. I'm talking about the year 2002. We donated her embryo, and sometimes luck favors the stupid. She immediately became pregnant. Very happy. वाह 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 क्या किया ऐसे. Very good. करिश्मा कुदरत का कभी-कभी हो जाता है. Then she didn't report to us for 4 months. We said चलो pregnant हो गई, कहीं अपने डॉक्टर के पास गई होगी. Then suddenly we find her again flat tummy. Well, I क्या हो गया? She's saying I wanted another donation. Well, why? Now what exactly happened? She was pregnant. She went to a doctor to do a sonography. क्या मालूम डॉक्टर का कितना सोनोग्राफी में नॉलेज होगा कि नहीं. He found out that she is carrying a girl child. So she said, I don't want a girl child, already have 2 daughters. So she aborted. And after abortion, it was found that the aborted fetus was a male. You got the idea? So she was confirmed that ये embryo recipient से तो male बच्चा ही पैदा होता है. So she came back to us कि मुझे दूसरा male child दो. मैं बोला मैडम ये बाजार नहीं है कि हमने सब ठेले में रखे हैं male child female child कि तुमको जो चाहिए उठा के दे दे. So then we drew her back. So such nasty cases also come. So much we are like blinders. People say even if I have 2 girls, I'm still considered childless. Now this stigma has to be shattered. We are spending crores of rupees, beti bachao, beti padhao, magar sorry to say, between us, I don't know whosoever might be listening, nothing works well. Only a part or a fraction of the society is advantaged by this. Discrimination is continuing. Sorry to say. I should not be encroaching upon this topic, otherwise it will take me 4 o'clock. Fine. Any questions or similar questions which you want to put for now? All are hypoglycemic. And in hypoglycemic condition, mind doesn't work well. Okay, fine. Okay, so we leave the meeting.
Yes, sir. Just before we end, I would like to present the vote of thanks.
Okay. So कब के रुके थे क्या? You were just waiting for me to stop. Anyway, carry on.
Sorry, sir.
Carry on, carry on.
It's an honor for me to be delivering the vote of thanks in the conclusion of our 2-day virtual tour today. It has been our privilege to host all the members and audience of this talk. We have been fortunate enough to have Dr. K.C. Sir as our guest speaker for this event. I would like to thank him for taking out his valuable time and sharing with us these words of wisdom and inspiring us to learn more. Very little attention has been paid to this global concern, which over the years has come around to be considered as a taboo. Infertility is the least vocalized concern under the broad umbrella of reproductive and sexual health. Unfortunately, infertility has not received the attention it deserves by public health policymakers and the government too, thereby leading to scarce investment and infrastructure to support research and provide everyone the access to preventative services, diagnosis, and medical treatment. The development of assisted reproductive technologies, such as in vitro fertilization, has opened up new opportunities for people to conceive a child. Moreover, IVF opened up options of parenthood for homosexual couples and transgender individuals as well, providing equality and inclusion. Developing a public health agenda that includes not only prevention and treatment, but also education and research so people are allowed the chance to make free, informed choices. It is about time that we see infertility care as both a medical and a social problem. While most such developments in the field of reproductive health are yet to be established, we are glad to learn all that we did on this comprehensive 2-day virtual tour. Taking our learning one step ahead from day one, on day 2 today, we had the opportunity to learn the various biological causes of both the male and the female perspective of infertility. Along with that, we also got to visualize the various essential instruments required for carrying out these processes in a professional laboratory. We are now more aware about the changes that are needed on our ends to accomplish a healthy, productive, reproductive life. It has been a very successful event, and thank you again, Casey sir, for enlightening us with such interesting information. I would
In
also like to
case-
thank
Sorry. Carry on.
I would also like to thank our beloved principal, Dr. Ashok Vadya, and the Department of Life Sciences, who gave us this amazing opportunity, and last but not the least, the wonderful audience for making this webinar so productive. So you wanted to say something?
Yeah, in case anybody wants any good reference books, my WhatsApp number is there. I have a few PDFs of certain very simple basic embryology books. I'll be there to share with you. Fine? Okay.
Yes, sir.
You can take it from Madam Zenia, or maybe I had just broadcasted my cell number on the screen. You can take it. Okay. So
Yes.
thank you for a patient hearing. Thank you for hearing me out for 2 days. ऐसा नहीं होना चाहिए कि जैसे मीटिंग बंद होगा तो बोलोगे 2 दिन पकाया उसने बहुत यार. हाँ, वैसा नहीं होना चाहिए. ठीक है? Okay. Chalo, bye.
So
See ya.
before we end the meet, can everyone please turn their cameras on for a group picture so we can capture this moment?
It looks like an embryoscope. Okay. Everybody's grooming their hair.
Yes, sir. Done.
Done? Chalo,
Yes.
thank you. Bye-bye. Pleasure being with you all.
Thank you, sir.
Take care. Bye-bye.
Thank you for everyone present here. Please fill the feedback form provided in the chat box before leaving the day.
Yeah, that's more important. Just share that with me. That's gonna be my acid test.
Yes, sir, surely. Stay safe and have a good day. Thank you.